Okay, so welcome to the Janjua Witness Protection Program. We have one more person. Sorry, can't see her identity. She's a very sweet Asian girl. I call her girl, but she's also, honestly a lady. She's very mature. And she came all the way from Seattle, and we're very excited to have her here. And if you notice, she had a lip lift done right there. So you can see the scars of the lift right there, and it was about 6 weeks ago. And it's important to realize that alarplasty and lip lift cannot be done at the same time. You can do it, but you shouldn't, because the risk of scarring and risk of not healing is very high. So you need to give a gap in between, and I'm glad that we have given time in between. So very good. Now let's get started and get this show on the road. We are done. The beautiful lady from Seattle is very happy, and so am I, because I wanted to do just this perfect job in terms of like keeping it right around between small to medium. And that's a challenge. That's not easy, because the amount that you remove doesn't necessarily tell you what it's going to look like. So you always have to make a judgment call, and I think this was a great judgment call. She's very swollen right now from local, but as you can see, they're very nice, they're symmetric, they're narrowed, but they're not too narrowed. I tried not to get into the cell. We do not want to narrow the cell. So there we go. Excellent. Right there. And we will get to see her in 4 or 5 days, and then we'll follow up as well. So very happy. Okay, great. So she has been sleepless in Seattle for so long, worrying about this problem. So no more sleepless in Seattle. She's going to be sleeping very well. Thank you for coming all the way. So here we are, post-op day number 4 only, and we have removed the sutures, as you can see, and she is healing really well. And that's despite having a lip lift 6 weeks ago. That's always a concern, but she's healing really well, as you can see. So that is fantastic. It's hard sometimes to get good closure because the lip lift incision is very close. But right now it looks great, and it was a subtle change, and right now you can tell, despite the swelling, you can tell the difference. The flare is going to be reduced, but it's going to be subtle. So patient is very happy. She's ready to head back to Seattle, and it was such a pleasure to have her. I'm so glad she came, and I wish her all the best.